What if your body has been warning you about diabetes and you've been ignoring it every single day? Before any blood test, before any diagnosis, the signs may already be visible right on your feet. And today, what I am about to reveal could change how you see your health forever. Most people believe that diabetes can only be caught by a blood test. You go to your doctor, the lab work comes back, and that's when you find out. I understand why people think that. For years, that's what most patients told me too. My name is Dr. Richard Ben, and I've been practicing medicine for over 20 years. And what I've learned, what I see confirmed in my office every single week, is that your body starts warning you about high blood sugar long before any lab result ever would. And the very first place your body speaks up? Your feet. The reason I'm making this video today is because of how many patients I've seen walk into my office who had every warning sign for months, sometimes years, and never knew what they were looking at. Today, I'm going to change that for you. Just last month, I sat down with a patient, a 67-year-old man, retired, healthy lifestyle, felt fine. He came in for a routine checkup. But before we did any blood work, I asked him about his feet. He told me, "My feet have been a little numb for a while. I figured it was just age." His fasting blood sugar came back at 214. He was diabetic and had been for over 2 years without knowing it. So today, I want to show you exactly what I showed that patient. 9 signs that were already on his feet and on millions of feet right now. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people. Let's get into it. Sign number 1 is something almost every patient has already experienced. Tingling, numbness, that pins and needles feeling in the feet. Frequent numbness, what doctors call peripheral neuropathy, is one of the earliest signs. The extra sugar begins attacking the protective layer of your nerves. Think of your nerves like electrical wires. When blood sugar stays high, it's like an acid slowly eating through that plastic coating. That fuzziness, that's the tingling. My recommendation? A 20 to 30 minute walk every single day. Movement is the best thing you can do to keep blood flowing to your feet. Sign number 2, hits them at night when they're alone and trying to sleep. When a patient tells me their feet feel like they're on fire, I take that very seriously. Burning in the soles of the feet is a classic early sign. Your nerves are misfiring, sending heat messages even though nothing hot is touching your foot. 2 habits. Drink at least 8 glasses of water a day and add more fiber to every meal. Fiber slows the absorption of sugar into your bloodstream. Sign number 3. This is the one that sends the most patients to the emergency room. Dr. Ben, I had a little blister 3 weeks ago. It still hasn't healed. When blood sugar is high, your body loses its ability to heal. It's like a garden hose with a serious kink in it. Nutrients simply cannot reach the wound. After your bath tonight, look at both feet carefully. If you see any cut or broken skin that hasn't improved in 48 hours, call your doctor. Not next week, 48 hours. Sign number 4, hiding in plain sight. Patients see their feet turning darker or more reddish, and they think it's just sun damage or age. This is your skin telling you that blood flow is inadequate. The skin may also become thinner and more fragile, as the tissue is starved of oxygen. Daily habit: 5 minutes of ankle circles and calf stretches every morning. Even elevating your feet slightly while you sit can make a meaningful difference. Sign number 5 surprises my patients most. Dr. Ben, my heels crack every winter. It's just dry skin. But no amount of moisturizer seems to help. Diabetes affects the autonomic nerves that control sweat. Your feet lose moisture from the inside out. Those cracks are open doors for infection. Moisturize every night, but never between your toes. That trapped moisture breeds fungal infection. And drink your 8 glasses of water daily. Have you noticed any of these signs? If yes, even one, go to the comment section right now and type the word yes. I read every single comment. Sign number 6 is more serious because it's about your kidneys. If your feet are consistently swollen and leaving deep sock marks, that changes the picture. When kidney function is impaired, fluid accumulates in the lowest part of your body. Think of your kidneys as the filtration plant that is now under stress. When you rest, elevate your feet above the level of your heart. Also, reduce sodium in your diet to stop your body from retaining water. Sign number 7. Patients say, "I figured it was arthritis," but sometimes the pain is stabbing, an electric shock, or a hot needle through the foot. The source is nerve dysfunction, not injury. Every morning, do 5 minutes of gentle foot and ankle stretching before you even get out of bed. Sign number 8. The damage is no longer in the early stages. Doctor, I've had cold feet my whole life, but are they cold even under 3 blankets? Your blood vessels have narrowed to the point where warm blood simply is not reaching the tips of your feet. The best response here is a 30-minute brisk walk. Sign number 9, a quiet sign. During a foot exam, I often see a visible absence of hair. Hair follicles need a steady supply of blood and oxygen to function. Think of hair follicles like small plants. When the irrigation pipe narrows, they stop growing. If your foot hair is absent, your circulation needs attention. We've covered a lot. These 9 signs are your body's way of talking to you. If you recognize these symptoms, don't panic. Take action. Go see your doctor. Thank you for watching. Please subscribe and share this with someone who needs it. Your health is in your hands. I'll see you in the next video.